Imagine waking up in a freezing ice age cave with a throbbing, infected abscess in your lower jaw, knowing there are no modern painkillers, no sterile clinics, and no antibiotics for tens of thousands of years. It sounds like an absolute death sentence, but archaeological discoveries have recently revealed that prehistoric humans had surprisingly effective, and sometimes terrifying, natural ways to handle agonizing dental emergencies. Long before anyone picked up a surgical tool, our ancestors looked to the forest floor to manage excruciating dental pain. For a long time, popular culture depicted Neanderthals as primitive, uncultured cavemen incapable of complex thought. However, a remarkable discovery at El Sidrón Cave in Spain completely shattered this myth. By analyzing the fossilized dental plaque on Neanderthal teeth, scientists uncovered traces of ancient chemical self-medication. One individual, who was suffering from a severe, visible dental abscess, had actively consumed poplar bark. Poplar bark naturally contains salicylic acid, the exact active chemical compound used to make modern aspirin. Even more shockingly, this same individual's plaque contained residues of Penicillium mold. This means that over 40,000 years before Alexander Fleming officially discovered penicillin in a modern laboratory, Neanderthals were already using natural antibiotics to fight off raging dental infections. They understood their environment intimately, using nature's own pharmacy to keep deadly oral bacteria at bay. But what happened when a toothache was mechanical, like an impacted tooth or food trapped deep in the gums? At the Krapina site in Croatia, scientists re-examined 4 associated Neanderthal teeth dating back a staggering 130,000 years. Under a light microscope, these teeth revealed a series of highly telling features: severe enamel fractures, deep scratches on the dentin, and multiple distinct grooves worn into the sides of the teeth. This wasn't regular wear and tear from chewing food. This Neanderthal had an impacted premolar and had spent days, perhaps weeks, aggressively manipulating the tooth. Using thin bone splinters or stiff grass stems, they had manually worked the instrument into their mouth at various angles to pry at the painful tooth and clear out irritating debris. It is the oldest known evidence of a hominid actively performing dental self-treatment to alleviate physical discomfort. When toothpicks and herbal remedies weren't enough, prehistoric dentists resorted to a much more invasive and terrifying solution: surgery. In the Altai Mountains of southern Siberia, archaeologists working in Shagarskaya cave unearthed a Neanderthal lower left molar dating back 59,000 years. This molar featured a massive, deep cavity extending from the chewing surface all the way down to the sensitive pulp cavity near the roots. But this wasn't just a natural hole caused by decay. Under high-powered scanning electron microscopes, researchers identified clear, circular, repeating striations worn into the cavity walls. These marks are the telltale signature of a sharp, rotating stone tool being twirled repeatedly between a dentist's fingertips. To test how this would have felt, scientists recreated the procedure in a lab, drilling into modern teeth using prehistoric-style stone points. They confirmed that a thin, sharp flint point twirled by hand is incredibly fast and effective at scraping away decayed enamel and draining infected pulp. The wear patterns on the Siberian tooth showed that the patient survived this grueling, unanesthetized procedure and continued to use the tooth to chew, proving the primitive root canal actually worked. As the millennia progressed, Homo sapiens refined these surgical techniques. At the Ripari Villabruna rock shelter in the Dolomite Mountains of northern Italy, archaeologists excavated a beautifully preserved 14,000-year-old hunter-gatherer skeleton. This young man, who died around the age of 25, had a massive carious lesion in his lower right third molar. When scientists scanned the inside of the tooth, they found deep, V-shaped microscratches and extensive enamel chipping on the walls of the cavity. Unlike the Neanderthals who drilled, this Paleolithic dentist had used a tiny, razor-sharp flint pick to manually scrape, chip, and lever the rotted, infected tissue out of the tooth. This delicate, painful scraping removed the decaying matter before it could leach into the hunter's bloodstream and cause a fatal systemic infection. Clearing out decay left a massive problem: an open, exposed tooth nerve that would cause blinding pain whenever the patient tried to eat or drink. The solution? Prehistoric dentists invented the cavity filling, In the mountains of northern Tuscany, at a site called Riparo Fredian, scientists examined teeth from individuals who lived 13,000 years ago. They discovered incisors that had been manually hollowed out and then tightly packed with naturally occurring bitumen. Bitumen is a thick, waterproof black tar that Ice Age people typically used to waterproof baskets and pottery. But the Stone Age dentists didn't stop there. Mixed into the tar filling were microscopic plant fibers and animal hairs. This was a deliberately engineered, prehistoric composite filling. The tar acted as an antiseptic, sealing out bacteria and protecting the exposed nerve from hot and cold temperatures, while the hair and fibers acted as a binding agent to keep the filling from cracking under the immense pressure of chewing. By the Neolithic era, dental fillings became even more elegant. In Lonce, Slovenia, researchers re-examined a 6,500-year-old human jawbone that had been sitting in a museum for over a century. Using advanced synchrotron X-ray imaging, they noticed something unusual on a cracked canine tooth. The tooth had a deep vertical fracture that exposed the highly sensitive dentin layer underneath the enamel. To treat this excruciating sensitivity, a Neolithic dentist had carefully packed the crack and the worn surface of the crown with pure beeswax. Because beeswax is malleable when warmed but solidifies at body temperature, it created a custom, soothing protective cap that insulated the exposed dentin tubules, allowing this young man to eat without blinding pain. By 9,000 years ago, dentistry underwent its first major mechanical upgrade. In Mehrgarh, Pakistan, archaeologists excavating a Neolithic graveyard made a mind-blowing discovery. Out of the skeletons unearthed, 9 individuals had near-perfect, tiny holes drilled directly into the chewing surfaces of their molars. These holes weren't made by twirling stone tools between fingertips. Instead, these ancient dentists used mechanical, flint-tipped bow drills, the very same high-speed tools used by artisans to drill decorative beads and start fires. The bow drill allowed for incredible rotational speed, clearing out deep tooth decay in a matter of seconds. Perhaps the most profound revelation of prehistoric dentistry isn't the technology, but the empathy it represents. Performing a stone drilling, prying open an impacted molar, or scraping a deep cavity with a flint pick is physically impossible to do to yourself without mirrors or modern lighting. Every single one of these surgical procedures required a dentist, another human being with immense patience, steady hands, and anatomical knowledge. These discoveries prove that prehistoric bands were not brutal survivalists who abandoned the weak. They were highly cooperative, compassionate communities where individuals cared for one another during severe medical crises. The agonizing ache of a bad tooth is one of the oldest shared experiences in human history, proving that our ancestors conquered pain not with high-tech machinery, but with profound ingenuity and deep compassion. If you want to uncover more mind-blowing secrets of prehistoric survival, hit that subscribe button and join our community of history explorers today.